By the time most of us reach 80, there's a very good chance, almost 80%, that our prostate will be enlarged. That can mean struggling to empty your bladder fully, getting up many times during the night, and that constant feeling that you need to go. And if we don't pay attention to it, it's more than just uncomfortable. It can actually lead to infections, bladder stones, and even damage to your kidneys. But here's something you might not know. A lot of this can be avoided, no matter how old you are. I'm Dr. Anya Sharma, and I've been helping men with their health for over 30 years. I've worked with so many men in their 60s, 70s, and 80s, helping them not only feel better, but actually avoid these prostate issues altogether. I've seen what truly works, what the science supports, and frankly, what's just a waste of your time. You might think that an enlarged prostate is just a normal part of getting older, or that if your father had it, you're destined to have it too. But I've seen men with a strong family history stay perfectly fine, while others, with no family history at all, develop problems early on. Often, the difference comes down to a few simple, everyday habits that either protect your prostate or slowly cause it harm. In this video, I'm going to share the same advice I give my own patients to keep their prostates healthy for years to come. We'll talk about the right foods, the right kinds of movement, and even some hidden risks in your medications that you might be missing. And towards the end, I'll share a simple little change you can make each day that takes less than a minute and could really make a difference in your prostate health. You'll want to hear about this. Before we get started, please subscribe to the channel and hit that notification bell so you don't miss any of my tips for prostate health designed just for men like you. And if you find this video helpful, please type a 1 in the comments. If not, type a 0 and tell me how I can make these videos even better for you. Okay, let's start with the basics. Let's talk about what the prostate actually is, why it tends to get bigger as we get older, and how this little gland can have such a big impact on your everyday comfort and your long-term well-being. Understanding this is the very first step towards taking good care of yourself. First, let's understand the prostate and why it enlarges. When I'm talking to a new patient for the first time, and I explain what the prostate actually does, I often see a look of surprise. Many men know they have one, of course, but they don't really understand what it does until it starts to cause them problems. The prostate is a small gland, about the size of a walnut, that sits right below your bladder, and it surrounds the urethra, which is the tube that carries urine out of your body. Its main job is to make seminal fluid, which nourishes and helps transport sperm during ejaculation. So, it's a really important part of your reproductive system, quietly doing its job for years without calling any attention to itself. But here's the thing. Because of where it's located, even a small change in size can really affect your comfort. As we get older, the prostate often starts to grow. This doesn't mean your body is failing you. It's simply because your hormones are changing. Specifically, testosterone, which is the main male hormone, starts to go down, while a stronger type called dihydrotestosterone, or DHT, can build up inside the prostate. DHT tells the cells in the gland to grow, slowly making it bigger. At first, you might not notice anything different, but over time, that growth starts to press on the urethra, making the passage narrower, and making it harder for urine to flow. For some men, that means a weaker stream, or having to strain to get started. For others, it means waking up in the middle of the night, sometimes many times, to go to the bathroom. And for many, it's just a nagging feeling that the bladder never really empties. I've had patients tell me, "Doctor, it's not really painful, but it's just exhausting." And they're right. The symptoms might seem small at first, but they can slowly wear away at your quality of life. Now, you might think this is just part of getting older, and in some ways, age is definitely a factor, but it's not the whole story. I've seen men in their late 70s with healthy, normal-sized prostates and no problems at all with urination. And I've also seen men in their 50s with significant enlargement that really interferes with their daily lives. So, what makes the difference? Often, it comes down to how your hormones interact with other things in your health, your weight, your diet, how active you are, and even the medications you're taking. Genetics do play a role. If your father or brother had an enlarged prostate, your risk is higher. But that doesn't mean it's guaranteed. I've worked with men who had strong family histories of BPH, but by making some changes in their lifestyle, they kept their prostates healthy and never developed any symptoms. And I've also had patients with no family history who developed problems earlier than expected because of things they could have addressed years before. There's also the issue of inflammation. Long-term, low-level inflammation, often caused by poor metabolic health, can make the prostate more sensitive to hormone changes. Things like high blood pressure, high blood sugar, and being overweight can all create an environment where the prostate is more likely to enlarge. That's why, as a urologist, I don't just look at your PSA numbers or give you an exam. I want to know about your overall health, what you eat, how you exercise, and what your daily habits are, because those are the things you can actually control. Understanding this connection is powerful. It means you're not just a bystander in this process. You really can influence the outcome. Your prostate's future isn't set in stone. It's shaped every day by the choices you make, what you eat, how you move, how you handle stress, and how you take care of your health. And that's why, before we talk about how to prevent problems, you need to really understand what the prostate is. It's a resilient, but also sensitive, part of your body that responds directly to how you treat it. Once you understand that, the steps you can take to protect it will really make sense. In fact, one of the most often missed and underestimated risk factors for prostate enlargement has nothing to do with your age or your hormones. And it's something you can start working on today. Let's take a closer look. Second, know your risk factors. When I'm talking to my patients about their prostate health, one of the first things I ask is if anyone in their family has had problems with prostate enlargement or other prostate issues. You'd be surprised how many men pause, think for a minute, and then say, "Well, my dad did. And now that I think about it, so did my older brother." That pause is important, because family history is one of the strongest clues we have. If your father or a brother has had benign prostatic hyperplasia, which we call BPH, your own risk could be up to 4 times higher. And if they had symptoms at a younger age, your chances of developing problems sooner are even greater. It's not just about shared habits. It's about the genetic blueprint you carry. In my own practice, I've seen this pattern play out so many times. I remember one patient in his late 50s who came in because he was waking up 3 times a night to urinate. He didn't think much of it at first, but when I asked about his family history, he told me his father had had prostate surgery at 62. That connection was a really important clue, because it meant we needed to be extra careful, start screening more closely, and make some immediate changes to his lifestyle to slow down the progression. Genetics don't determine everything, but they do give us a map of where problems might be waiting. Your background can also affect your risk in ways that most men never consider. For example, African American men tend to develop prostate issues earlier and often more severely than men from other backgrounds. Researchers are still studying why, but it's probably a combination of genetics and things in the environment. Knowing this isn't meant to scare you. It's to help you take action sooner and more decisively. But here's the part that surprises many men. Risk factors go way beyond your DNA. Your overall health plays a huge role in whether your prostate stays healthy or starts to enlarge. Conditions like being overweight, high blood pressure, and type 2 diabetes, which are all part of what we call metabolic syndrome, significantly increase the chances of developing BPH. These issues create an environment of inflammation in your body, and inflammation is a quiet, constant cause of prostate growth. High blood sugar, for example, doesn't just affect your heart or your energy levels. It can also subtly damage the delicate tissues of the prostate over time. Extra body fat can throw off your hormone balance, leading to higher levels of DHT, which sends even stronger signals for the gland to grow. I've had men come to me convinced that their urinary symptoms were just part of getting older, only to find that improving their diet, losing a little weight, and getting their blood pressure under control made a real difference in how often they needed to use the bathroom. The great thing about addressing these non-genetic risk factors is that you can start making changes right now, no matter how old you are, or what your history is. And the sooner you start, the better your chances of keeping your prostate healthy for years to come. Another thing that's often overlooked is your daily habits. What you eat, how often you move, how you handle stress. Even things that seem small, like sitting for long periods without taking breaks, can indirectly lead to poorer circulation and more inflammation, setting the stage for problems later on. That's why knowing your risk factors isn't just something to think about. It's a way to identify the areas where you have the most power to make a difference. Once you know where you're vulnerable, whether it's because of your family or your current lifestyle, you can make smarter, more focused choices to protect your health. And the next step is one of the most powerful things you can control: because what you eat every day can either help protect your prostate or quietly work against it. Let's talk about the foods that really make a difference. Third, eat to protect your prostate. Over the years, I've noticed something interesting in my patients. The men who seem to age the healthiest, with fewer prostate problems, often have a similar way of eating. It's not about strict diets or denying themselves foods they enjoy. It's about choosing foods that quietly help them, day after day, year after year. When it comes to prostate health, what you put on your plate is just as important as what you leave off. One of the best ways of eating that I recommend is the Mediterranean diet. It's not a fad, and it's not a quick fix. It's a way of eating that focuses on fresh vegetables, colorful fruits, whole grains, healthy fats like extra virgin olive oil, and moderate amounts of fish and poultry. It's satisfying, flavorful, and most importantly, full of nutrients that fight inflammation. That low-level, silent inflammation that can slowly cause the prostate to enlarge. Let's talk about a few key foods. Tomatoes are at the top of my list, and for good reason. They're full of lycopene, a powerful antioxidant that's been shown in many studies to lower the risk of prostate problems. The magic happens when tomatoes are cooked, like in pasta sauce or tomato soup, because the heat makes the lycopene easier for your body to absorb. Then there are cruciferous vegetables, broccoli, cauliflower, Brussels sprouts. These have compounds that help your body get rid of harmful substances and protect the health of your cells, including the ones in your prostate. On the other hand, some foods can quietly work against you. Diets high in saturated fats, red and processed meats, and large amounts of full-fat dairy can promote inflammation and throw off your hormone balance. I've seen men make a simple change, replacing a few red meat dinners each week with fish or plant-based proteins, and notice a difference in their overall energy and, over time, in their urinary symptoms. It's not about never enjoying a steak again. It's about finding a balance and making sure that most of your meals are helping you, not hurting you. Another tip I often share is to think in colors. A plate full of greens, reds, oranges, and purples means you're getting a variety of antioxidants and vitamins that help support every system in your body, including your prostate. Walnuts, almonds, flax seeds, and chia seeds add healthy fats and plant compounds that can help reduce inflammation. Even what you drink matters. Green tea, for example, contains compounds that support prostate health. Making these changes doesn't have to be overwhelming. Start with small, consistent adjustments. Add a serving of vegetables to your lunch. Swap soda for water or tea. Choose whole grain bread instead of white. Over weeks and months, these small adjustments add up to a powerful protective effect. I've had patients tell me they didn't think dietary changes would make much difference, but within a year, their lab results improved, their energy levels went up, and their urinary symptoms became less bothersome. That's the power of nutrition. It works quietly, but it works. What I love about focusing on diet is that it's something you control completely. You can't change your age or your family history, but you can decide what you eat today. Every healthy choice is an investment in your future comfort and independence. And when you combine the right foods with another key habit that supports healthy hormone balance and improves circulation, you create a strong defense against prostate enlargement. That habit doesn't start in the kitchen. It starts with how you move your body each day. Fourth, keep your body moving. If there's one thing I wish every man over 60 could really believe, it's this: your body was made to move. And movement is one of the most powerful medicines for your prostate. I've seen men who were convinced that slowing down was just part of aging, until they decided to take action. Within months of adding more physical activity into their daily lives, they noticed not only more energy and a better mood, but also a clear improvement in their urinary comfort. The science supports this. Regular movement helps reduce inflammation, improves circulation to the pelvic area, and supports healthier hormone balance, all of which directly benefit the prostate. You don't need a gym membership, and you certainly don't have to train like an athlete. In fact, some of the most effective activities are the simplest. Walking briskly for just 30 minutes a day, 5 days a week, has been linked to a significant reduction in BPH symptoms. That's only about the length of a TV show, but the payoff can be years of better health. Walking gets your blood flowing, strengthens your heart, helps you maintain a healthy weight, and keeps the muscles around your bladder and prostate functioning smoothly. Of course, walking isn't the only option. I've had patients who prefer cycling, swimming, gardening, or even dancing with their spouse. The activity itself matters less than doing it regularly. The key is to find something you enjoy, so it becomes a natural part of your day, instead of a chore you dread. Movement lowers stress levels, and stress can contribute to hormone imbalances that may worsen prostate issues. So, in that sense, exercise isn't just physical therapy for your body, it's therapy for your mind as well. I remember one gentleman in his early 70s who came to me frustrated by frequent nighttime trips to the bathroom. He was skeptical when I suggested more walking, saying he'd never been an exercise guy, but he agreed to try, starting with just 10 minutes after breakfast. Over the course of 6 months, he worked up to 45 minutes a day, and his symptoms noticeably improved. He slept better, his blood pressure dropped, and his PSA levels stabilized. His only regret was not starting sooner. It's important to note that you don't need to push yourself to exhaustion. In fact, overtraining can increase inflammation. What we're aiming for is steady, moderate activity that you can maintain over the long term. Think of it as keeping your engine running smoothly. A little movement every day keeps the system in balance. Even small changes, like taking the stairs instead of the elevator, parking farther from the store, or standing up every hour to stretch, can add up over time. Exercise also supports metabolic health, which we know is closely tied to prostate health. By keeping blood sugar in check, managing your weight, and improving your heart health, you're creating an internal environment that's less likely to fuel prostate enlargement. And when you combine that with the right nutrition, the benefits really multiply. Your body responds to how you treat it, even in your later years. You can choose to give it what it needs to thrive, or you can let it slow down and face the consequences. The good news is, it's never too late to start moving. Every step, every stretch, every bit of activity is a vote for better health tomorrow. And while staying active is a powerful tool, there's another factor that can quietly undermine your progress. One that may already be sitting in your medicine cabinet. So let's talk about it before it causes more trouble than you realize. Fifth, watch out for medication traps. One of the most often missed conversations I have with my patients is about the medications they take every day. Most men think of their prescriptions, or over-the-counter pills, as completely separate from their prostate health. But the truth is, some of the most common drugs can quietly make urinary symptoms worse. I've seen men who were doing everything right, eating well, staying active, keeping their weight in check, and yet, their nighttime bathroom trips kept increasing. When we looked closer, the problem was hiding in plain sight, the pills they were taking for other conditions. Antihistamines, the kind you might use for seasonal allergies, can tighten the muscles around the urethra. When your prostate is already a little enlarged, this extra tension can make it harder for urine to pass through, leading to a weaker stream, or that frustrating feeling of not emptying your bladder completely. Decongestants, often found in cold medicines, can have a similar effect. They work by constricting blood vessels to reduce swelling in your nasal passages, but unfortunately, they can also constrict muscles in the urinary tract. It's a perfect example of how something that helps one problem can aggravate another, without you even realizing it. Then there are tricyclic antidepressants, sometimes prescribed for mood disorders, or even chronic pain. These can relax the bladder muscles too much, or interfere with the nerve signals that control urination. The result is urine retention, and a higher risk of urinary tract infections, which are not only uncomfortable, but can lead to more serious complications in older men. I once had a patient in his mid-60s who came in convinced he needed prostate surgery. His symptoms had gotten dramatically worse over the past year. After reviewing his medications, I noticed he had started a daily allergy pill about 12 months earlier. We worked with his primary care physician to find an alternative that wouldn't impact his urinary function. Within weeks, his symptoms improved so much that surgery was no longer necessary. That's the kind of change that happens when we connect the dots between medications and prostate health. The important thing to understand is that I'm not telling you to stop taking your medications. Some are essential for your heart, your blood pressure, your mental health, or other serious conditions. But it's really important to have an honest discussion with your doctor about everything you're taking, prescriptions, over-the-counter drugs, even herbal supplements. Bring a complete list to each appointment. This allows your healthcare team to identify possible interactions, and when it's appropriate, recommend safer alternatives, or adjust your dosages. Regular medication reviews are especially important if you have multiple health conditions, and you see more than one doctor. Specialists often focus on their own area of expertise, and without good communication, no one may realize how one prescription could be affecting another aspect of your health. As your urologist, I see it as my responsibility to advocate for a balance between treating your existing conditions and protecting your prostate health. Think of it this way: your efforts to eat well, exercise, and manage stress are like building a strong house for your health. But if a medication is quietly undermining your urinary function, it's like having a hidden leak in the roof. Eventually, it's going to cause damage unless you address it. And while medication traps are a hidden danger, there's another area where many men miss the opportunity to protect themselves. One that has nothing to do with what you take and everything to do with how closely you monitor your health over time. This next step is the foundation of prevention, and it can make the difference between catching a problem early or facing a much bigger challenge down the road. Let's talk about it. Sixth, get checked before problems start. If there's one thing I wish every man over 60 would really understand, it's that waiting for symptoms to appear before seeing a doctor is a gamble you really don't need to take. Prostate problems, including enlargement, can develop quietly for years, without causing obvious issues. By the time the signs are noticeable, the weaker stream, the extra trips to the bathroom, the interrupted sleep, the gland has often already grown quite a bit. The earlier we identify changes, the more options we have to slow them down, or even reverse them. I've met so many men who came to see me only after months, or even years, of living with discomfort. Many admitted they had been too busy, too embarrassed, or simply too convinced that it was just part of getting older. But I've also had patients who took a more proactive approach, and the difference in their outcomes is really striking. Early checkups give us the chance to act while the problem is still small. Sometimes, all it takes at that stage is a few changes to your lifestyle to prevent the need for medication or surgery down the road. Regular prostate screenings should become a normal part of your healthcare routine after age 50, and even earlier if you have risk factors, like a family history, or if you're African American. The most common test is the PSA blood test, which measures prostate-specific antigen levels. An elevated PSA doesn't automatically mean cancer, but it tells us that something in the prostate needs attention. Along with that, I recommend a simple digital rectal exam, which allows me to feel the size and texture of the gland. These two tests together give us a more complete picture than either one alone. In some cases, we might use ultrasound imaging to get precise measurements of the prostate's size and shape. It's quick, painless, and can reveal changes that might not yet be causing symptoms. I remember one patient in his early 60s who came in for his routine checkup. He felt fine, but his PSA was slightly higher than usual. The ultrasound showed some mild enlargement. Nothing alarming, but enough to encourage him to make some changes in his diet and exercise. A year later, his prostate size had stabilized, and his PSA was back to normal. Without that early detection, he might have been facing more serious symptoms within a few years. These checkups aren't just about finding problems. They're about building a prevention plan that adapts with you as you age. Your health isn't static. Hormone levels shift, weight can change, and other conditions can develop over time. By staying in touch with your urologist and getting regular checkups, we can adjust your plan so it continues to protect your prostate effectively. I know some men dread these appointments, thinking they'll be uncomfortable, or that they might hear bad news, but the reality is that most of the time the news is good. And even when it's not, catching something early almost always means it's easier to treat. In fact, the peace of mind you get from knowing exactly where you stand is worth far more than the temporary awkwardness of a brief exam. So, don't wait for symptoms to push you into action. Be proactive, be informed, and take ownership of your health. Think of these screenings as insurance for your quality of life, a small investment of time that can pay off in years of comfort and independence. And while regular checkups are essential, there's one more habit I want to share with you, a simple, everyday action that takes less than a minute, but can really make a difference in protecting your prostate function. Most men overlook it completely, and yet, it's something you can start doing today. Let's get into it. Seventh, the simple daily habit most men miss. Over the years I've spent helping men with their health, I've realized that sometimes it's not the big, complicated treatments that make the most difference. It's the small, consistent habits you do every single day. One of the simplest, and yet most overlooked, is something so basic that most men don't give it a second thought: how you empty your bladder. It might sound trivial, but trust me, it's not. As we get older, the muscles and nerves that help the bladder contract can weaken a little, and an enlarged prostate can make the pathway narrower. This means it's easier to finish urinating while still leaving a small amount of urine behind. Over time, that leftover urine can cause a chain reaction of problems. It can increase the risk of urinary tract infections, put more strain on your bladder, and even worsen the symptoms of benign prostatic hyperplasia. The habit I encourage all my patients to adopt is to take an extra 20 to 30 seconds at the end of urination to fully relax, breathe, and let the bladder empty completely. Don't rush. Don't strain. Just give your body the time to finish the job. Some men find it helpful to shift position slightly. For example, leaning forward a bit while sitting to help gravity assist in the process. These small adjustments may seem insignificant, but over time, they can protect both your bladder and your prostate function. I remember a gentleman in his late 60s who had been waking up 3 times a night to urinate. He assumed it was just part of aging, and that nothing could be done without surgery or medication. When we talked about his daily habits, I realized he was always in a hurry, especially during the day. He admitted he rarely gave himself time to completely empty his bladder because he didn't like standing in the restroom for too long. I asked him to commit to slowing down, both during the day and at night. Within weeks, he noticed he was waking up less frequently, and the constant sense of urgency began to fade. No pills, no procedures, just patience and awareness. This habit also ties into staying well hydrated. Many men with urinary issues try to solve the problem by drinking less water, thinking it will mean fewer bathroom trips. Unfortunately, this can backfire. Concentrated urine irritates the bladder and can actually increase urgency. The goal is to drink enough water to keep your urine pale yellow, and then make sure to empty completely when you go. It's a reminder that prostate health isn't just about what happens in the doctor's office. It's about the choices you make and the care you give your body in the quiet, everyday moments. And the best part is, this habit costs nothing, takes no extra equipment, and is entirely within your control. If you start today, you might not feel an immediate, dramatic change, but give it weeks, then months. Over time, you'll be reducing strain, lowering your risk of complications, and improving your overall comfort. It's one of those small investments that pays off in ways you may not even notice at first, but you'll be glad you made it. And now that you've learned this final, simple habit, it's time to bring everything together, from understanding your prostate, to knowing your risks, to choosing the right foods, staying active, managing medications, and getting checked regularly. In the conclusion, I want to show you how all these pieces fit into one clear plan you can follow for the rest of your life. It's the roadmap I've seen work for countless men, and it could work for you, too. Conclusion. When I think about the men I've treated over the years, the ones who age with strength, comfort, and confidence, they all have one thing in common. They take an active role in their health. Prostate enlargement may be common, but it is not something you have to accept as inevitable. You now know the key steps, understand how your prostate works, and why it changes with age, know your personal risk factors, nourish your body with the right foods, keep moving every day, be mindful of the medications you take, get checked before problems start, and adopt the small, daily habits that protect your urinary function. These aren't just medical recommendations written in a pamphlet. They are real, practical actions I've seen transform lives. I've watched men who were frustrated, tired, and resigned to their symptoms turn things around completely, sleeping through the night again, traveling without worry, and enjoying their lives without the constant interruption of the bathroom. You have the power to create the same outcome for yourself. Every meal you choose, every walk you take, every conversation you have with your doctor is an investment in your independence and your dignity. Prevention isn't about perfection. It's about consistency and the belief that your health is worth protecting. So, don't wait for discomfort to dictate your decisions. Start today. Begin with one change. Maybe it's adding more vegetables to your dinner, taking that extra stroll after lunch, or finally scheduling that checkup you've been putting off. These small choices build on each other, and over time, they create a future where you are in control, not your prostate. Your health is your story to write, and it's never too late to turn the page.